Hello, and thank you for visiting my poster presentation. My name is Justine Karduck. I'm a registered dietitian nutritionist and a clinical associate professor from the University of Illinois Urbana-Champaign. The title of the poster is The Feasibility and Self-Management Practices of the Real People with Diabetes Study. Little research is focused on how practicing dietitians use apps in authentic patient care settings with people with diabetes. This study describes the challenges of dietitians leading a research project investigating the feasibility of conducting a health-based app intervention for managing type 2 diabetes using the framework from the National Institute of Health, NIH. The self-care practices of the people with diabetes within the study were also analyzed. This was an observational longitudinal design, and it served as a basis for a future intervention with external federal funding. Both quantitative and qualitative data were collected from participants, including hemoglobin A1C, blood pressure, lipids, weights, BMIs, surveys about apps and their self-care behaviors, clinician and administrator interviews, and the research team was comprised of 2 RDN faculty and 3 dietetic students, 4 RDNs, and 1 nurse from the Riverside Diabetes Wellness Center in Bourbonnais. The inclusion criteria were they had to have type 2 diabetes or a prediabetes diagnosis, a self-reported A1C of 5.7 to 9%, a willingness to share their health data with the research team, and be ready to complete online or paper surveys every 3 months over the course of 12 months. The 6 areas of feasibility examined included acceptability, demand, implementation, adaptation, practicality, and integration. The qualitative analysis included one-on-one interviews with healthcare administrators, 4, and 1 semi-structured discussion group with the diabetes and nurse educators from the diabetes clinic before patient recruitment began. An inductive thematic analysis was used. So the major findings were that although most participants were smartphone owners, 87 of the 121, few were health app users. So only 22 were actually using health apps to track their health behaviors. Demand was medium, but acceptability, implementation, adaptation, practicality, and integration were low. So implications for dietetics practice include that dietitians and nurse educators should acknowledge that health apps may be useful for patients. Still, adequate training is needed for healthcare providers and their patients before using them. This study's systematic feasibility evaluation can be a model for other clinical initiatives integrating health apps into practice. A dedicated project manager, examination of the administrative and clinical protocols, adherence to the guidelines for diabetes care, and accordance between app acceptance and integration into practice need further evaluation for the success of a future health app intervention. Thank you for listening. Bye-bye.